Namaskar. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant, non-stop show 1048th episode. Let's have the headlines of the day. Microsoft expands AI capabilities to shape a healthier future, unveiling several Microsoft Cloud for healthcare innovations that connect care experiences, enhance team collaboration, empower healthcare workers, and unlock clinical and operational insights. India's first rapid Mpox kit test kit ready for technology transfer to hit market soon, as per the ICMR NIV. TIFR study uses psychedelic drug to trace neuron that can reduce anxiety. Agilis Diagnostics launch pharmacogenomics testing services. Study finds how new imaging methods accurately detect kidney cancer. Now let's go to the topic of the day. सारी नई इनोवेशंस की, नई टेक्निक्स की, एआई की एंट्री इनटू हेल्थ केयर की बात करते हैं, पर आज हम बात करेंगे कि क्या हेल्थ ब्रेक थ्रूज हुए हैं भारतवर्ष में पिछले 77 ईयर्स में। और इस जर्नी के थ्रू ले जाने के लिए हमारे पास हैं डॉक्टर शारदा जैन. Dr. Sharda Jain is a distinguished leader in obstetrics and gynecology with over 20 years of faculty experience in renowned institutions like PGIMR Chandigarh and Lady Hardinge Medical College. As the founder and secretary general of Delhi Gynecologist Forum, she has played a key role in promoting women's health and upholding medical ethics in India. Dr. Jain has served as an expert in OB-GYN on the ethical committee of both the MCI and the NMC, contributing significantly to setting high standards in medical practice. Her contribution to the field have been honored with numerous awards, including the Lifetime Achievement Award and the Living Legend Award. Dr. Jain is deeply committed to teaching, advocating for doctor safety, enhancing medico-legal awareness, and making her a respectful figure in the medical community where everyone looks up to her for latest knowledge, looks up to her in times of need, and she is continuing her profession and also guiding all of us through all our tough times and good times. Welcome, Dr. Sharda Jain. So, आज का टॉपिक हम शुरू करें, मैम?
Yes, ma'am.
It
It's a
is
pleasure always to be associated with you.
It is an honor to have you over, ma'am. So हम हेल्थ केयर इन द लास्ट 77 years of independent India की बात कर रहे थे. तो how has this evolved, the healthcare field evolved since independence?
I think it is very eye-opener for me and you and for the people who are listening that since the time we have got independence, 1947, what we had and where we have come a long, long way. I think, at that particular time, if you take the indices like maternal mortality was very high, it was at 2000, infant mortality was very high. In terms of fertility, it was very high. And then, many diseases like smallpox, polio, tuberculosis, rampant anemia. I think slowly, I think in the last 75 years, I will say that we are definitely slow, but our achievements are spectacular. And you'll be happy to know, and our viewers also will be happy to know if we just go down few of the things. You wish to ask me something more before I get on to few slides?
No, ma'am, you get on
All
with
right,
the few
all
slides.
right.
I'm sure you'll answer everything in that.
Perfect. As you can see here, that there is a marked improvement in the key health and the demographic indicators. And these are life expectancy, in 1947 was just 32 years. And now we find in 2023 it is 70 plus. As far as the maternal mortality is concerned, when we got independence, it was 2000, unbelievable. And now, very gracefully, with the hard work of our government, the gynecologists, and all fraternity, we have come down to graceful 97 per lakh. And it is said that by 2030, as far as goals are concerned, that we should be 70, will be very easily 70. But we want to be like developed countries where we'll be one digit. I think we will definitely able to do it. As for the infant mortality is concerned, one can see here that it was, when we got independence, it was 145. We have come majorly down to 28 per thousand live births. As far as our total fertility is concerned, we are at 2. In fact, to be very exact, in 2024, we are at 1.94. And it is expected by 2050, it will be 1.8. As for the adolescent fertility is concerned, it is at 1.63. And the people who are educated adolescents, it is only 1.1. As far as the menace of female feticide is concerned, Anita will vouch with me that it was a nightmare. 10 million girls were lost due to female feticide since 1990. Almost 50,000 girls were lost annually. And now we find gracefully that it came down to 2011 census, 943 girls to 1,000 boys. During this National Family Health Survey, when the COVID was there, our females were much, much better. It was 10-20, but that's really not right. Now it is said that today's time, for 1,000 boys, we are 943 girls. And by 2036, girls will be 952. Our expected population today is 152, it is going to be in 36. And that time, the female population, which is 48.5%, will be 48.8%. As for the disease eradication is concerned, I think kudos to India. Smallpox had been eradicated long back. 1979, yes. Polio went out of India. 2014, we are free of guinea worm and yaw disease. As far as the maternal and neonatal tetanus is concerned, we are free of it by 2015. The goiter had disappeared by simple intervention of salt iodization. Malaria, at present time, when we got independence, it was 75 million in a population of 330 million. In 2020, it is 5.6 million, and it is the government aims to eradicate malaria altogether by 2030. As far as tuberculosis is concerned, I think the government aims to eradicate it by 2025, but it is in sustainable development target. It is by 2030, tuberculosis to khatam hi ho jayegi hamari country se. Now, as for the AIDS is concerned, I think, thanks to government of India, we had a peak time of 1.5%. Then in 2000, it came to 0.5%, and today we are 0.2%. And new cases have declined by 50%. There's improved survival is there due to antiretroviral therapy. And you'll be happy to know that there are 500 ART centers who are giving free treatment to 1.5 million people. Over to you, Madam.
Okay. So what do you think were the major healthcare policies that came into practice over last 75 years, which have helped us achieve so much?
Ma'am, as far as the key policy, all of you know about it, that National Health Policy came in 1983. And then there was launch of immunization program in a country, which was made universal immunization program in 1985. Then came the National Rural Health Mission. Then it was combined with the rural plus urban missions. And then you find lately it is Ayushman Bharat and Swachh Bharat. So I'm going to just dilate on this thing again with a couple of slides. You'll bear with me a little bit.
Yeah, it's okay. Madam, in the last 1 week, trachoma has also been declared. India has been declared free
Actually,
of
trachoma is
trachoma.
free. Yes, yes,
Yes,
yes.
yes.
Good. Sorry, I will
No
take it
problem.
again. I by mistake I did it. Sorry,
It's a visual treat to see your slides, and they leave an imprint on everybody's mind.
madam. I can see here. Now, answering your question, one can see here. I will just take tobacco, which is big menace as at
Yes,
present time. Initially, India invested in tobacco cultivation and earned a lot of money. But the soon government realized that the cost of tobacco related diseases exceeded much more than the economic gain by the tobacco cultivation. So they brought it down. They brought a tobacco control policy in 2003. And the same year, it not only said, it took a pledge to control global tobacco control. That also came in 2003. Now you can see here that electronic nicotine products and gutka are banned in our country. And there's a 50% reduction in consumption of tobacco. But in adolescent also, it has come down from 35% to 24%. But the only state which is doing it very meticulously is Tamil Nadu. The rest have to get it up. Now, as for the National Health Mission is concerned, which is combined rural and urban missions, we all know that the focus had been on the maternal and child health. This decreased maternal mortality and infant mortality and less than 5 years child mortality. The major innovations had been institutional deliveries. 90% cases are now institutional delivery. They take place in primary health center, in district hospitals, in small nursing homes, but they are not delivering at home. There's a big no to home deliveries. The ASHA workers, which are millions of things, they are accredited social health activists. They have been rolled up in our health program, and they are doing a wonderful job, wonderful job. These ASHA workers are pillar of our primary health care. They are great mobilizer for institutional deliveries because the government of India doesn't want any home deliveries. They are supporting immunization programs. They are distributing iron folic acid. They are also distributing contraceptive pill and creating awareness. They are helping the government in giving medicines to patients who have tuberculosis. And they are now going to be engaged in a very big way in non-communicable disease and mental health problems. Now, the credit must be given to institutional deliveries for bringing down maternal mortality from 2000 to almost less than 100 years, 100 per lakh. Besides Janani Suraksha Yojana, there is Janani Sishu Suraksha Karyakram is also there. And now you can find that the private sector gynecologists can help in Pradhan Mantri Surakshit Matritya Abhiyan, which is there on the 9th of every month. Now, you can see that a Swachh Bharat mission, which was started 10 years back in 2014, only in 10 years' time, you can find that our open defecation has been reduced to nil, and it's promoting sanitary napkins. It is creating waves. As far as Ayushman Bharat is concerned, again, a wonderful scheme which was started in 2018. It was a major leap in giving a free 5 lakh per year to people who are below poverty lines. So 500 million, which is 40% of the population, has been benefited. And now you know that in this September 2024, this year only, the senior citizens who are 70 plus, 70 and the 70 plus are also included. which also are going to big help to this senior citizens who family refuse to take care of them. Now, it's in Ayushman Bharat, there is a lot of focus has been there on a health wellness center. 5 lakhs health wellness centers have been started, which will be manned by the senior sister. They'll be manned by people who can teach yoga and a preventive care, and they'll be responsible. And all this screening will be there for hypertension, for diabetes, and for cancers like cancer cervix, cancer breast, and oral cancers. And I think, once the emphasis has been there on this non-communicable disease, which is taking 60% of the deaths of India, I think we will definitely see, once we discuss it out 5 years down the line, myself and Anita will discuss, I think the story will be very different.
So yes, this is my third question: the role of vaccination in all these good things that are happening around us.
I think, anywhere it is said that vaccination remove the disease which is prevalent and killing by the tune of 95 to 100%. जिन जिन चीजों का वैक्सीनेशन आ गया है, 90 to 100% बीमारी खत्म हो गई है. आपने देखा स्मॉल पॉक्स चला गया, आपने देखा पोलियो चला गया, आपने अभी और बहुत सारी चीजें हैं जो कि ऑन द वर्ज ऑफ गोइंग. सो दिस इज बिकॉज ऑफ the vaccination. This vaccination was started in 1978 and it became a universal immunization program in 1985. Now it targets almost 300 million deliveries, which the pregnant ladies are giving tetanus and diphtheria toxoid, and the newborns are covered with 12 vaccines which are given free. Now, in Mission Indradhanush, which has been started from the last 10 years, the focus has been there on a poor vaccination coverage areas. And it is again doing wonders by bringing down child mortality in those areas. COVID-19 had been countrywide mass immunization. It has shown the world that not only we can take care of the Indian population by giving over 2 crores vaccination, but it has supplied vaccination to 110 countries more. HPV vaccination, government has announced that in national immunization program, the adolescent girls from 9 to 14 years will be included, and this will amount to over 1.4 crores HPV vaccination. It will be again largest in the world. This is going to be rolled out. The work is being carried out, and probably next year it will be rolled out. As for the access to medicine is concerned, we all know that India is a pharmacy of the world. And this is because of a policy which was taken in 1970. From product patenting, it became to process patenting. Now we can generate generic drugs and which can supply drugs to many, many countries. AIDS success story, all of you know. India's export of antiretroviral drugs to South Africa catalyzed the global movement of affordable medicines. You can see here, now an HIV patient can live like a normal person by spending only $1 a day. And currently there are 350 Indian drug manufacturing units which are endorsed by the European Union as well as by many US regulations. 50% of the vaccines which are used for various global child immunization programs are made in India and exported to 101 countries and the UN entities. Yes, over to you, ma'am.
Yeah, the health infrastructure has changed over decades. So how has that developed to such a good advantage to all our facilities being available?
Madam, it's eye opener to you and me. Now there is a health infrastructure mission 2021. There is a digital health mission. This is going to strengthen the Ayushman Bharat platform. There's enhanced connectivity is going to be there of 4 programs which are run by the state governments. Also, it will have a universal health coverage, and things are not far away when we all will have unique numbers of hours. Now we have telemedicine, which was illegal before. Now the legal barriers have been removed by the National Medical Council. Now we have COVID app. All our immunization of COVID are entered here. And in future, each and every diseases will be and entered. We will have a unique ID for ourselves, and all things will be entered as for our health indices are concerned. And point of care diagnostic systems will transform India's primary care in a very, very big way. What are these? This point of care test was innovated during COVID times. All of us knew pulse oximeter. We became used to our blood pressure apparatus. So now those point of care tests, every family will have kit for blood pressure checking up. Every family will have blood sugar checking up machines are going to be with them. So it has going to help the doctors and the people who have the disease in a very big way. And there'll be less strain on the individual people. Much people will be much more empowered, and this will do a very big work as far as non-communicable diseases is concerned. As for the supply chain management of the drugs is concerned and the consumers is concerned, it will become more efficient. And the disease surveillance also will become real time. I just now told you this is called ABHA, Ayushman Bharat Health Account. Each one of us are going to have a unique ID, and this unified health interface. Say if I'm Dr. Anita is here in Faridabad, she goes to Bangalore and she falls sick. Now there will be digital highway will be created, so all her records from the previous institutions can be transferred to these places from Faridabad to Bangalore. So I think this will integrate the health services across the country, which is not there in the best of the places in the world. And I'm sure India will be the torch bearer, and it will change the system of medical records from institution to institutions. And as for the diverse health systems are concerned, I am just going to close it because Pradhan Mantri ji feels the preventive care is with Ayurveda. But as far as the curative care is there, which is in the hands of modern medicine. And that's why they are bringing out medical pluralism for healthcare. Modern medicine is going to take care, which is composed of a high quality doctors, nurses, and the health professionals are going to cure the curative aspect. But the traditional system of our medicines are going to take care, that is yoga and the holistic Ayurveda things are going to take care of a preventive healthcare. So I think as for the strength of this particular country is concerned, they are absolutely big. Just 1 minute. I'm going to just stop presenting. Where is stop? Madam, where is stop?
Yeah, it has stopped, ma'am.
It is stopped. Okay, that's it.
Yes.
Ma'am. So you're free to ask me any questions now.
Okay. So
I will like you to contribute what I have said. How do you endorse it, madam?
I really endorse it 110%. Everything you have said is the absolute truth, and every government policy has actually handheld the people and led them to the doctors. We do produce so many doctors every year, although many of them do go abroad, but still we have a lot many staying back and taking care of our own. And even in the rural areas now, more and more people doctors are moving and helping the people over there. And the we have to grow towards this system of health that it is available to them, because otherwise they switch to Unani, and they have good qualities in Ayurvedic, homeopathic, Unani systems. But if we have genuine enough doctors, definitely they can also help wherever those facilities are available. So things are changing, but somehow the India's approach to mental health care in recent years is something that I'd like to ask you about.
Ma'am, the mental health policy has come very late. We all know that Indian people, because of scenario which is there in the country, there are a lot of anxiety is there in about 70% of people, and the depression is also close to almost 50%. We are stressed out quite a bit, but I'm sure, and the ratio of the psychiatrist with the general population, we find there's a lot of shortage of psychiatrists. But given another decade, we'll find through these wellness programs, things are going to improve in a very big way. This is a neglected area, and this is because you can see there that the medical colleges are opening here left and right. Is because there is a shortage of doctors, and the
Doctors.
nurses has to be taken care. And you can find that the scenario, as far as the urban city is concerned, they are much better, but in rural areas, in slums, there are a lot of gaps. And I'm sure once the budget of health from 1.3 to goes to 5%, which WHO prescribes, I'm sure we'll definitely see that in another 25 years, when India is supposed to be Viksit Bharat, that particular time we will have lot of things, and we will not be in any way inferior to the Western counterparts of ours.
That was very nice, and you ended beautifully on a very positive note. And I wish everybody has this optimism, because things are improving, and whatever you've said is the ultimate and the truth. So, thank you, Dr. Sharda Jain, for joining us today. Could you show us the certificate, please?
Certificate to both
Thank
of
you,
us.
ma'am.
Thank you very much, doctor.
No,
Thank you
thank
very
you,
much,
ma'am.
doctor.
You
Thank you
you
very much.
really put it across so well and so forcefully that it is really ingrained in the mind. Yes, we are doing so well, and we'll do
your
even
your
better in
guided
future.
question your guided questions were very provocative. Just say that there was a flow as far the presentation was concerned. Thank you very
Yes, and
much,
that
Dr. Anita Kant, for giving me this opportunity to be
that's all.
associated with you in this public
Thank you.
awareness programs.
Thank you, ma'am. And the
Thank you.
visual presentation has really made an impact. Thank you so much. That will
Thank you
be
very
all
much.
for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Thank
Thank you,
you.
ma'am.